Welcome to the CERT Program Overview webinar. I am Mary Moko. I'm a member of the WPS Provider Outreach and Education team, and I'll be your presenter today. I'm joined by my teammate, Ashley Dakota, who will assist with some behind-the-scenes help. This webinar is for folks that are wishing to learn more about the CERT program. But first, we do need to talk a little bit about some housekeeping on the next slide. The presentation is available for download from our live events webpage. The web address is in the chat. You can take some time now to download it if you haven't already done so. We are recording this session, and barring any technical issues, we will post the recording on our Encore Presentations webpage, where it will remain for about 60 to 90 days. The recording will also post as a YouTube channel video, where it will remain as long as the information remains current or until we otherwise decide to remove it. Now, if you have any questions during today's presentation, please place them into the chat. I will answer questions as time permits, and if I don't get to your question, I will email the response after the webinar. If you have a question on a specific claim, we're not able to assist you today. Claim-specific questions must be referred to customer service, where someone is able to access and look at claims history. On the very next slide is information that we share in nearly all of our events. It is our disclaimer, and this disclaimer is placed into this presentation to remind you that this presentation is for educational purposes only. I made every effort to verify the information that I'm going to provide is current and accurate, but it is subject to change. It is on the CMS website where you will find the Medicare rules that determine final coverage, and these laws and regulations and rulings are what will always prevail. One final reminder, CMS prohibits recording of this webinar for profit-making purposes, so we do ask that you do not record the presentation. We will create an encore of the presentation, and you will have that for future reference. Now, on the next slide is the agenda for this event today. I'm going to provide you with some background about the CERT program, and CERT is the Comprehensive Error Rate Testing Program. I'll provide for you a bit about the process the CERT contractor takes to perform their reviews, and I'm going to explain to you why CERT findings should matter to Medicare providers. I'll provide you with a lot of resources along the way. We may not be able to use the chat to provide additional resources for you today, since Ashley is actually sharing her screen today while I'm presenting because I couldn't access and share my screen. I'm having some technical issues here. So anything that we would have placed into the chat or I may mention is in the chat. Please know that I'll get that information to you just shortly after today's presentation when I get that list of participants from WebEx. We'll finish then with questions and answers. So on to the next slide. Let's get started with some background about CERT. As I mentioned, CERT is an acronym that stands for Comprehensive Error Rate Testing, and it is a program that Medicare administers. On the next slide is information about the history for improper payment measurement of Medicare claims. And the task fell to the Office of Inspector General, or OIG, from 1996 to 2002. They sampled only a small number of claims. OIG asked the contractors listed here on this slide, including carriers and fiscal intermediaries, that's what MACs used to be known as, and they enlisted them to perform review, coverage, coding, and payments for these sampled claims. Now, it was those individual contractors that reviewed their own claims. And I think it's fair to say that that was not exactly an ideal situation. When completed, OIG calculated a single national claims payment error rate based on the errors assessed by those contractors that reviewed claims. On the next slide, it tells you that a few years later, in 2012, Congress passed a law that required the heads of federal agencies to annually review programs that they administer to improve efforts to reduce and recover improper payments. That law, known as the Improper Payments Elimination and Recovery Improvements of 2012, referred to in short as IPERIA, amended the previous Improper Payments Information Act of 2002. Next slide. This slide shows types of improper payments along with some examples that are used by CMS to calculate improper payments in the Medicare program. Incorrect payment can be in the form of an overpayment, but it could also be an underpayment. CMS generally considers as an improper payment those examples that I've shown here on the bottom of this slide, and this includes payment to an ineligible recipient for an ineligible service, or payment that is a duplicate payment, payment made for services that are not covered by Medicare, could be statutorily or otherwise, or payments made for an incorrect amount. The next slide shows requirements in the IPERIA law that do not pertain only to CMS, but to other federal programs that may be susceptible to significant improper payments. Now, each year, these federal agencies are required to estimate the improper program payments and submit those estimates to Congress. They may also report publicly the estimates and what the agency is doing to reduce the improper payments within their program. The next slide expands a bit on the transition when OIG was no longer responsible for the improper payment measurement. It was CMS, the Centers for Medicare and Medicaid Services, that assumed this responsibility in 2002. Transition actually began back in 2001, at which time CMS followed recommendations by OIG. Now, one of the recommendations made was to increase the sample size to 50,000 claims per year. The transition from OIG to CMS allowed for computing not just a single national claims payment error rate that was calculated previously by OIG, but also calculate multiple improper payment rates by contractor, by service, or by provider type, just to give you some examples. Now, just last year, in 2024, the CERT review sample size decreased from that 50,000 claims per year to 37,500 claims annually. Next, and on the next slide, I'm going to transition now and talk a little bit about the CERT contractors. There are two. There is the CERT review contractor. You might hear me refer to that as the CERT RC. And there's also the CERT statistical contractor, or the CERT SC. Let's take a look, or a closer look on the next slide, where I've listed some of the CERT RC's tasks. Now, this slide lists the responsibilities of the CERT review contractor. They sample all of the claims. They're responsible for requesting and receiving and imaging, of course, the medical records. They also must render quality control on those records that are being sent to them by Medicare providers. Of course, they must furnish customer service. There is also educational support or education support. They are the ones that are actually responsible for reviewing those medical records to determine if there was an improper payment made. They also compile data and share it to Congress and various federal agencies. And they maintain the CERT provider website, the CERT claim status website that's used by the MACs, and the MAC is a Medicare administrative contractor like WPS. And they also manage the CERT management website that is used by CMS. The next slide shows the CERT statistical contractors' tasks or responsibilities. And they actually calculate improper payment rates and amounts, And they designed that sampling strategy in order to know which claims were selected for review, all 37,500 of them. They also maintain the live data dashboard that's used to look at and um, analyze that improper payment rate from day to day or month to month and so on. The next slide then begins my transition to the CERT process. Just as I advertised, I'm talking about the steps in the CERT process, which are listed on the very next slide here. This is a list of steps in the process taken by the CERT contractor. It really begins with that claim selection. Next, the CERT RC will request records. Once received, they are imaged and then they're reviewed. If the CERT review contractor determines an improper payment, and remember this could include an overpayment or an underpayment, an improper payment category is assigned during that review process. Finally, the last step in the process is to actually calculate the improper payment rate. So this process encompasses both the CERT review contractor and CERT statistical contractors' responsibilities. On the next slide, I'm providing information to you about letters and contact information. The CERT review contractor issues an additional documentation request, we call that an ADR, to obtain medical records for each claim sampled for CERT review. Now, I mentioned earlier that the CERT review contractor maintains a CERT provider website, and on that website, you can view examples or samples of the initial and subsequent letter request schedules. Recently, the CERT review contractor initial letter request schedule changed. Beginning with review year 2026, providers will only have 60 days to respond to the CERT documentation requests. And if no records have been submitted, the claim will be denied for non-response. Now, that time frame used to be 75 days. Responding within 45 days, if not before, is always the best practice to ensure timeliness. Now, remember, if the claims aren't received in a timely fashion, it's going to be deemed an error or no response. Now, claim submission dates for each review year are from July 1 of 2024, or for the 2026 year, I should say, is July 1, 2024 through June 30 of 2025. So it's review year 2026, but those claims came from the sampling of claims submitted July 1 of 2024 through June 30 of 2025. Now, the letters and contact information page on the website includes a lot of information, and this includes how to submit address updates, including how you can request that subsequent additional documentation requests, or those ADRs, be sent to an alternate address. There's also information about how some providers may be eligible to establish a single point of contact, so that when the CERT contractor needs to communicate with the provider office or offices, there can be one single point of contact. On the next slide, I have actually listed for you those functionalities or the information that's available on that CERT, they call it C3 Hub website. C3 Hub is the name of the CERT provider website. So this includes a listing of some of the features. Some of them I've talked about already. You can see a completion status chart just to know if the review is completed yet or not. You can look at claim status search. There's that sample of those additional documentation request letters. And very, very important, if I had this on paper, I'd be circling this right now, is document request listings. And what I mean by that and what they mean by that, like what you can find on the C3 Hub website, is a list of all of the documentation that you need to send to the CERT contractor if they send you a documentation request letter. So for example, there's Part A, there's Part B, there's durable medical equipment tabs that you can click on this website, and it will then drop down a list of the document request listings for services that are billed to Medicare. So for example, you can look at psychotherapy note information. You can look at evaluation and management. So if you receive a request for documentation from the CERT contractor for evaluation and management service, that document request listing is going to tell you all of the information you need to send. Let me provide you with another example. Let's say it is a chiropractic manipulation on a claim selected for CERT review. The document request listing will show you if you receive a request for documentation for a chiropractic manipulation, what do you need to include when returning that medical record to the CERT contractor? As you can see here, there's FAQs and contact us information and even more than that. Now, I didn't advertise that I'm going to discuss the content of that CERT C3 Hub website in detail during my webinar today, but I am planning to host a CERT C3 Hub website demonstration, and that's going to be on Thursday, June 23rd of 2025 from 11 a.m. to noon Central Time. You can check out our live events webpage to register. On the next slide, I'm expanding a little bit about the medical record request by the CERT contractor. All first additional documentation requests or ADR letters for CERT review are sent to the address on file with the provider enrollment chain and ownership system, that's PAYCOS for short, for the provider or supplier that billed or submitted the claim to Medicare. So the CERT contractor is sending that first ADR to a provider based on the address on file in PAYCOS. Now you can find other details related to CERT medical records on the CERT C3 Hub website. This includes HIPAA, the Health Insurance Portability and Accountability Act compliance details, lists of items to send for different documentation requests. I just talked about that. Also where to send those records and how to submit them and even more. The next slide provides details specific to sending that documentation to the CERT review contractor. You can send it by all of the methods that are listed on the left hand of the slide. Of course, we have U.S. Postal Mail. You can fax records in. You can use the electronic submission of medical documentation. We shorten that up and call it SMED. You can submit on CD. And of course, you can email it or as an attachment. You can send it with an email. The submission methods are on the CERT website. It tells you here on this slide on the right-hand side how to navigate to those submission methods if you're a navigator versus a searcher, or if you don't have the URL handy or a link in anything. You go to the home page, choose Submit Records to CERT from the left side menu. But the CERT C3 Hub includes all of this information. Again, I'll be walking through and demonstrating that website in an upcoming webinar. The next slide addresses those additional documentation requests, and sometimes during their review, the CERT review contractor staff may identify a need for more information. You know, let's say they get the documentation from a provider, but something's missing. They need something that wasn't sent initially with the documentation or those medical records. And when that happens, the CERT review contractor will issue a new documentation request for that specific item or that missing documentation. Now, it's important to note that the time frame for returning those additional records is shorter than that 60-day time frame when they reach out initially. So you need to make certain that you're paying attention to those dates in those documentation request letters that you send. Now, the next slide lists for you the 5 major error categories that are assigned to errors that are assessed by the CERT contractor. upon review and discovery of an error, the CERT review contractor is going to assign an error category. And this is part of the data that the CERT contractor, our statistical contractor, later shares in some of those annual reports that I'm going to talk about in just a little bit. But the five major error categories, one of them is other, kind of a catch-all category. But the major error categories include no documentation. And this is one of those situations where there's no response, there's no documentation sent or returned to the provider, or to the CERT contractor rather. I apologize for that. There is also an error category called insufficient documentation. And this, folks, has been the most common error assessed recently, and for quite some time now, for WPS errors, CERT errors, claims that are improperly paid by WPS and reviewed by the CERT contractor. Insufficient documentation could mean, or does mean, I'm going to give you an example, that the provider returned documentation when they received that ADR from the CERT contractor, but something was missing. So maybe the information was shared, but there was no plan of care, and that needed to be there. Maybe documentation was returned, but we couldn't find the order. So that would be a situation where an insufficient documentation error would be assessed by the CERT contractor. Another type of error is medical necessity. And I like to tell people that policy equals edits, and medical necessity is connected to policy. So that means there's edits within the claim processing system that should be catching these services to make certain that they're medically necessary. But a CERT review could result in a determination that a service was improperly paid or not paid due to medical necessity. Another error category is incorrect coding. Typically, incorrect coding translates for Part B services to upcoding or downcoding, most often in evaluation or an E&M service. Now, it's no surprise that there are incorrect coding errors on Medicare claims because this is an error category that's typically assigned for an evaluation and management service. That makes sense because 40% of all claims submitted to Medicare include an evaluation and management service. And remember, this is a kind of a random selection of claims submitted to the MAC that the CERT contractor is actually pulling for review. So incorrect coding could be upcoding or downcoding. Now, here's something to consider specific to evaluation and management services. And we do go into detail and provide education on E&M services. We have a lot of videos of that type of education, recordings of education we provided out on our YouTube channel. So if you're looking for E&M education by WPS, look to our YouTube channel and you'll be able to find that. And again, I'm sorry that I'm not able to have Ashley throw these URLs or these links into the chat during this presentation today because she's actually sharing her screen. And you can't do that because you can't see the chat. We will follow up and provide you or make sure that you have all these resources following today's event. If they're not already included as a resource here in this presentation, I just want you to be assured that you have all of these great resources that I'm touching upon. So those are the assignment of error categories. On the next slide, I'm talking about a tool that WPS uses or makes available to providers. It's called the CERT Claim Lookup Tool. If your claim is selected for CERT review, you can use our self-service CERT Claim Lookup Tool to view status or view results of CERT reviews. This is a tool that's available on our website, and it's actually hyperlinked in presentation materials. If the CERT contractor finds no error, there is no letter sent at all. So sometimes providers say, well, I received a request for documentation, but I don't know what happened. I don't know if the claim was correct or paid correctly, and I don't know if an error was assessed or if the claim review has been completed. So this tool actually allows you to look at the status of a review. So you'll know that indeed the review is complete and there wasn't an error, but otherwise there is no letter sent to a provider to tell them that. Now, if you choose to use the claim lookup tool, you can verify no error. You can see when an error is assessed, and you can verify when a review is still in process. Now, if an error is assessed, you'll also be able to view the CERT review contractor's comments for all of the lines in error on a reviewed claim. So to use this tool, you simply include the CERT identification number, or what they call the CID, in the lookup tool. You're going to enter the CERT identification number. Where do you find the CERT identification number? You can find it in a barcoded sheet that is sent by the CERT review contractor when they send you the documentation request letter. It does include the CERT identification number. And again, that's the number that you'll use to populate in this lookup tool in order to find CERT status or results. Here on this slide, you can see the status definitions that I've listed right there for you. And again, if an error is assessed, there's going to be review contents for all of the lines in error on that reviewed claim. Now, on the next slide, I'm talking a little bit about the actions we take. We are not the CERT contractor. We are your Medicare administrative contractor. We don't do or perform the CERT review. But if the CERT contractor finds an error, there are actions that the MAC or that WPS needs to take. They use a secure communication tool in order to share the review results with us, and they ask us to take corrective action. Now, this action could be recovering an overpayment, and we would do that. We would make the adjustment to the claim. We would send that overpayment letter out to the provider. But it also could include or result in us making an additional payment. For example, you were underpaid. The service was submitted as a 99212, but based on the documentation the CERT contractor reviewed, they deemed that it should have been a 99213. So you were actually underpaid, or the provider would be underpaid in that situation. So the MAC, or the CERT contractor rather, would reach out in the secure communication tool, provide their comments, and tell us to make that additional payment. The next slide talks a little bit more about the actions that the MACs take for CERT errors. And I did want to let you know that when WPS receives an error notice in that secure communication mechanism, when we receive that error notice from the CERT contractor, someone at WPS in our medical review area will actually review the very same documentation to determine if we agree with that error. Or maybe we might think that there are more records, maybe something's missing, that we could get to reverse the error. If we believe the documentation is missing, our staff is going to contact the provider to request those missing records. And if we receive the records that are needed to reverse that error, we're going to forward those records to the CERT review contractor, and we're going to ask them to review that additional documentation, because we want the CERT error rate to be as low as possible. We want to make certain that providers are receiving the correct payment for their services. On the next slide, I've included information about appealing a CERT decision. When providers disagree with a CERT decision, they do have the right to appeal the error. They do need to follow the Medicare redetermination process. That is the first level of appeal. Now, it's important that you understand the reason for the CERT error prior to filing an appeal. And I'll give you an example or some questions. Was your error due to missing documentation? This missing documentation should be submitted with your appeal request. Was your error due to a missing signature? You'll need to submit a valid attestation with your appeal request, or an electronic signature that was appended at the time of the service. Now remember, though, that you cannot use an attestation statement for missing signatures on orders. Another question is, were you missing documentation of medical necessity? If so, when filing your appeal, it's imperative to submit the office note or the documentation in that medical record that shows medical necessity or the reason the service was rendered. This helps to make certain you include the missing or needed records to support that billed service when requesting appeal. Just asking yourself some simple questions like that. Now, as long as timely filing occurs, all other levels of appeal, there are 5 total, are available when appealing a CERT decision. So let's say you request an appeal on a CERT decision at level 1, which is the redetermination performed by the MAC. And let's say that the decision by the MAC is unfavorable. You do have rights to the all other levels of appeal as long as they're submitted timely. And again, the only level of appeal is the first level, the redetermination, that are rendered at the MACs. Now, before I provide you with some resources, I do have one more item on our agenda that I want to talk about, and that is why CERT findings should matter. You may be wondering, why do they matter? Now, the next portion of the webinar is going to focus on answering exactly why those CERT findings should matter. On the next slide, there is data for the reporting period of claims that were sampled July 1 of 2022 through June 30 of 2023. That is the most recent CERT report available. It's in the overall improper payment rate for fiscal year 2024. And that error rate is 7.66% of all Medicare fee-for-service claims. So Part A, Part B, and durable medical equipment claims. The estimated overall improper payment rate for fiscal year 2024 is $31.70 billion. That is the projected improper payment amount for that 7.66% of errors. And one thing you need to realize, and I want to talk about it now before moving to the next slide, is sometimes a claim may be pulled or sampled by the CERT review contractor. They'll ask for documentation, and let's say the CERT reviewer finds that an error occurred for a lab service because it wasn't medically necessary. But on that claim, the provider also billed for the venipuncture. If Medicare is not going to pay for the lab service, then Medicare is not going to pay for the venipuncture. Well, the last I knew, and this could have changed, I've been in Medicare for quite a few years, a venipuncture was at one time reimbursing about $3 a piece. So, you know, if a provider gets their letter or their overpayment letter from WPS based on a CERT review, we're going to ask for the money back for the lab service. We're also going to ask money back for that that venipuncture code. Maybe we paid $8 for the lab and $3 for the lab service. And that's not a huge overpayment by any means. However, part of what the CERT statistical review contractor does is they project the improper payment amount. So if the improper payment rate for procedure 36415, a venipuncture, is X amount of dollars, what the CERT statistical contractor is going to do when calculating the overall improper payment rate is they're going to project the improper payment amount for that service. So, you know, small amount paid for this service, but ask yourself, how many times does that service get submitted to and paid by Medicare? Many, 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 many times. So that projected improper payment rate, although the actual dollar loss is small on the reviewed claim, it's projected to the universe of claims. So something to keep in mind. Any overpayment, any underpayment is an error, and we need to fix those or avoid them in the future. Now, each November, and on the next slide, I've included some information about CERT reporting, but each November, the Department of Health and Human Services publishes their improper payment rate reports in their annual agency financial reports. I just mentioned to you that the last or the most recent payment rate report that was posted was 7.66%. I believe I remember back at a time when that overpayment amount, or improper payment amount, I should say, because remember, overpayments and underpayments are improper payments. So the improper payment amount was around 13%. So we've come a long way. We have been providing education just like this one today and other education in order to drive down that overall improper payment rate. But CMS publishes the yearly CERT reports on their website. They're easy to find, but I've embedded a link to that in your presentation material. Now, the reports are listed by the CERT report year. Remember, claim submission dates are July 1 through June 30 for each report year. For example, the 2024 Medicare fee-for-service supplemental improper payment data includes claims that the CERT contractor sampled or claim submission dates July 1 of 2022 through June 30 of 2023. So we're always kind of doing a look back with these reviews. So one of the important things that we do, and all of the MACs do, is we look at trending and we look at that data for those claims submitted some time ago that were included in the review, and we actually have to look to the future to see if we anticipate the same types of issues occurring. We're trying to avoid those improper payments in the future. So sometimes the claim review dates or the claim submission dates are quite a while back, but we still have to be aware, looking forward, that these services or these reasons that errors are being assessed, still could be occurring. So we have to be looking at that and monitoring that all the time. On the next slide, I've included some content of the CERT report. If you've never reviewed the contents of a CERT report, I highly recommend that you take some time to do so. There's a lot of great information there. As you can see, I've summarized here what's included in the CERT report, but these reports provide valuable insight into the CERT program findings and their impact. The data is used for monitoring and evaluation purposes, and each CERT report allows you to review the data in different ways, including by contractor, by state, by type of service. For example, could be evaluation management services or maybe laboratory services. So unlike what OIG did back in the day, they didn't drill down to all of these different ways of looking at the data for those errors assessed. They're now being drilled down so that you can review that data in different ways. We can look at the error categories, root causes for Part A versus Part B versus durable medical equipment, prosthetics, orthotics, and supplies claims. We can look at state, as I mentioned, different claim types, and so on and so forth, even by type of service, so we can really drill down. On the next slide, I've listed the ways that CMS uses CERT findings. CMS uses the CERT report to identify and address improper Medicare payments. Now, by identifying and addressing these improper payments, CMS is really aiming to reduce the overall error rate and to improve compliance with Medicare rules and regulations. Now, this can involve modifying internal processes or implementing new edits and even making other changes, all of this to ensure proper payment. Medicare review contractors use CERT findings or results to determine needs to initiate medical review. It's just one of the sources that any medical review contractor considers. So we're looking at that report. We're looking at CERT review findings to see if it may be a vulnerability for us in our payments. Contractors will analyze the errors, and we make adjustments to recover overpayments, and sometimes we have to make payment for underpaid services. So CMS and its contractors really use CERT data to educate providers about common errors and areas for improvement. And this can be done through various outreach efforts, such as providing information on best practices or updating billing manuals, or even offering educational workshops, just like the one that you're participating in right now. So on the next slide is information that just expands a little bit on the importance for providers. CERT findings are important so that you can identify those billing errors and be in compliance with claim submission. It's very wise for providers to use CERT findings to maintain financial integrity and regulatory compliance, just as shown here on this slide. Because CMS uses CERT findings to identify program vulnerabilities, if you're in the know about CERT findings, it really helps helps providers identify those that may result in medical review of their claims, or those payment or program vulnerabilities. You can recognize that what the CERT review contractor is finding and reporting is just a source that identifies a program vulnerability. And contractors like WPS will look at those findings, and then we may initiate medical review of our claim universe in order to see if those overpayments exist. There are things that you can do to prepare for a CERT audit, and that begins on the next slide. I've listed some steps that you can take to prepare for a CERT audit, and the best plan is really just to be prepared and be proactive. Consider conducting internal audits to identify areas of non-compliance, and stay informed about Medicare changes. WPS invites you to sign up for e-news and read it. A lot of people sign up, but we have data that shows they're not reading it. It does little good to sign up if you're not reading it. You need to stay informed. Also, consider signing up for CMS's listserv. On the next slide, there are some steps that you can plan to take if you receive a request for documentation from the CERT contractor, or that additional documentation request, or ADR, however you want to name it. Verify the request. Ensure the validity and identify the requester. Make certain it's legit. Make sure it looks like the envelope that the CERT C3 hub shows you as an example. This is what your letter is going to look like. You know, pick up the phone and call if you need to ensure the validity of that request. Now you're going to look over the request, review it, understand the purpose and scope, and that information is included in the documentation request letter you receive. You're going to need to gather all of the information. So locate and assemble all of the information requested. Use those lists of documentation out on the CERT C3 Hub website. And identify if any documents are missing. You know, do you have it all? Is it all there? And if so, identify those actions that you need to take to obtain it if something is missing. Of course, once it's all pulled together, you're going to organize the information and arrange it in a logical manner. Make copies, keep a copy of the information that you're sending to the CERT contractor. You will submit those medical records. Again, follow instructions on the C3 Hub website, and make certain that you're sending that bar-coded cover sheet when returning records to the CERT contractor. And that direction is actually included in your documentation request letter. It tells you, send this bar-coded cover sheet when returning the records to us. So consider follow-up to confirm that records were received. So, all in all, have a plan and share it with those that need to know within your organization. So once that documentation request comes to you and the clock starts ticking, because you only have a number of days to get that information back, make sure that you can hit the ground running. Have that plan. Communicate it beforehand. Let people know these request letters are going to come, and they're going to look like this. And remember, you can designate a point of contact, a provider can, once you receive, or when you're receiving that second documentation request letter. They don't do it for an initial documentation request, but once you get to 2 requests for documentation, they'll allow you to contact the CERT contractor and set up that point of contact within your organization. So this brings us now to resources, which is the final portion of my presentation or my prepared remarks. And I don't know if you can call resources prepared remarks or not, but I do want to make you aware of what's out there and available so that after this call today, you'll be able to go and find all of this great information or these nuggets of information that I'm sharing with you. On the next slide, I have included a link to the CMS CERT webpage, or in your handout. It's linked. This allows you to go to the CERT webpage. You can see the background that I talked about today. It gives you provider information. You can link to those CERT reports that I suggested you take a look at. And you can also find improper payment rates and additional data. The next slide provides the web page for a task force that I am a member of. It is the CERT ABMAC Outreach and Education Task Force, and CMS maintains a web page on their website for this task force. It includes links to education resources. As you can see, they're all listed here. I don't need to read through all of them. Presentations, CERT videos, other related links, and so on and so forth. For those products that are created and later accepted and published by CMS based on the recommendations of this task force, you will see the CERT AB MAC Outreach and Education logo, and I've actually included that here on this slide for you. So anything that comes from the efforts of this task force will have that logo on it. There's also another very similar logo that is used for the Durable Medical Equipment, or DME MAC, Outreach and Education Task Force. And sometimes we collaborate with them on those topics that cross over for each of those types of claims. So we might talk about orders or certifying equipment and such. So it would both be Part B services, and then of course DME claims as well for the actual equipment. So we might collaborate on some of that education. WPS has, just as shown on this next slide, is guides and resources for CERT. This includes links to resources or articles that we published out on our website based on review findings of our claims. Another meeting that I attend is an internal CERT work group meeting where we meet monthly. We monitor our improper payment rate. We look at what kind of errors are being assessed, what's the category of the error. We look at the code for the error. We might analyze data and share that information during a meeting to determine, do we need to develop education on XYZ, and so on and so forth. You know, do we need to publish a news item? Do we need to host a webinar? Do we need a half-day session that talks about CERT 101 through, CERT examples, CERT error examples? So we're always assessing the needs for education. That's where people like Ashley and me and all of our provider outreach and education team really find it important that we work with our medical review staff so we can share this information. They explain the findings. We help create education and publish it so that we can avoid those errors in the future. Another thing that we publish, and it's, I believe, extremely helpful, so I like to mention this to folks, is the quarterly CERT error findings report. And this is actually a compilation of the CERT errors assessed for WPS claims. And we separate these that are published on the website by those error categories. So you'll find examples of improper coding. You'll find examples of insufficient documentation or no documentation, or medical necessity errors that have been assessed for claims submitted to WPS. These are published on a quarterly basis. And the nice thing about these, and I can't show you right now, but you can click on the link in your handout that you received to open it up. But sometimes I like to pull open a web page and show it during the web the webinars that I host. But the nice thing about the quarterly CERT error findings report is that for each of the errors, it provides you with citations of why or where you can find you can't do that, or why that error was wrong. You know, a lot of times when an error is assessed, one of the first things we hear from providers is, where does it say XYZ? So for each of those error findings, the CERT contractor provides the citations they use. Did they use the internet-only manual? Was it a national coverage determination? Was it a local coverage determination that backs up why that claim or that claim line was improperly paid? So that's great information, and you can actually click on and open those resources as you're looking at that error findings report. So some really good stuff, as I like to call it. All right, next is a time that we set aside. Just a few minutes left for questions and answers. I have opened up the chat, and again, I apologize, but we haven't been able to view the chat and take care of it and handle it. But if you have questions, you can enter them into the chat, and we'll make certain that we get a response back to you. Now, we can do this one of two ways. We can email you directly. We'll pull that chat document. And I see Ashley now has added this to the chat. Thank you, Ashley. We can pull the chat document and see your questions, and we can provide you with an answer either in a direct email to you, the individual learner, or we can make a list of all of the questions and all of the answers and send them out to all of the learners during this presentation today. But it is 10:57, so seeing no questions yet, I am going to move on to some other important information I have to share. So I'm going to ask you, Ashley, to move the slide to the Certificate of Achievement slide. And this tells you a little bit about how WPS provides you with a Certificate of Achievement that you can present to an accrediting organization or body to consider awarding you with continuing education units. So in a few minutes, you are going to receive an automated email. It's not going to come from WPS, it's going to come from WebEx, and it's going to thank you for attending. If you are seeking CEUs for today's education program, don't delete that email before you read it, because the email is going to contain your Certificate of Achievement. If you look at the slide that appears right now, in the bottom left corner, there's a red box that says Certificate of Achievement. Your email is going to have your name, today's date, the name of the program, and the contact hours. And it is that email that you need to submit to AAPC or another accrediting organization so that AAPC or that other accrediting organization can consider award of CEUs for you. We don't do that. We provide you with the Certificate of Achievement. There's so many organizations that we would need to make arrangements and get numbers for, that this is the way we make certain everyone has access to their CEUs. We provide this Certificate of Achievement. If you don't see that automated email from WebEx, check your spam or your junk folder. If you find it there, you might want to consider adding that WebEx email address to your Safe Sender list, so that if you join us for webinars in the future, the same thing doesn't happen, so that it comes directly to you and not your spam or your junk. Now, listen carefully, please. If you joined by phone only, if you're not seeing slides, you're only listening today, you will not receive this automated email from WebEx, because WebEx does not know your telephone number. The report shows up with just a telephone number on it versus an email address. So if that's the case, if you listen by phone and you need that Certificate of Achievement, send an email to our education mailbox. The email address is listed here on the slide, and I can quick put it in here because I can talk and type at the same time now. This is our education mailbox address. Give us your name, today's date, the name of the webinar, and that telephone number that you called in from. And after we verify your participation on our WebEx reports, we can send you a Certificate of Achievement. If you think of any more questions, please advance the slide, Ashley. If you think of any presentation related questions, not claim specific, or if you submitted one in the chat and we haven't answered it and I haven't seen any questions yet, you do have 1 week from today to submit them. Send them to our education mailbox, put the webinar topic or the title in the subject line. And remember that claim specific questions must be sent to customer service. Staff in provider outreach and education doesn't have access to claim details. One more slide, actually two, but this one is perhaps the most important. Please take time, take a few minutes to complete a survey. I gave you a lot of information today. I want to know, what did you think of the information presented? What did you like? What could we do better? Aside from the technical issues, of course, and we tried our best, and I think we overcame them. Suggest topics for future education. Your feedback really is invaluable. It drives what we do. We look at every single survey return. CMS looks at many of those surveys that are returned. They are counting on you to let them know, did WPS give you a great customer experience? There's different options depending on your preference, different options for the survey. Thank you, Ashley, for placing the link into the chat. This survey is so important that we'll give you another chance to complete it. When you exit the webinar today, you'll be redirected to the CMS Qualtrics page for that survey. It's going to look like what you see in the bottom center of this slide, that notice that says external site with the yellow triangle. It's not spam, it's not junk. If you haven't already done so, click on that blue button and please give us some feedback about your experience today. Next is the final slide. On behalf of myself and Ashley and our entire provider outreach and education team, I do want to thank you for your participation. We know you're busy. We know you're doing a great job. We look forward to your survey comments and we hope to have you join us for future events. You may now disconnect from the webinar today. Have a wonderful day, everyone.